Hello, Namaste. I'm Dr. Amit. So yesterday we talked about autonomic receptor, and today we'll move forward in our pharmacology series. And today we'll talk about acetylcholine receptor in just few minutes. So let's start our today topic, acetylcholine receptor. Okay. So in simple language, acetylcholine receptors are that receptors which receive acetylcholine. Okay. So just think that ACH is a key and receptor is a lock. Okay. So you can say that suppose this is a receptor. Okay. And suppose this is a ACH. Okay. Then this ACH will go and will fix in this receptor. Okay. So in the same way it works in our body also. Okay. So this acetylcholine receptors is mainly of two major types. Okay, one is called nicotinic receptor and one is called muscarinic receptor. Okay, so let's first talk about nicotinic receptors. So the first point about nicotinic receptor is, so these nicotinic receptors are ligand gated channels. Okay, so don't confuse with this word ligand. Okay, so this ligand means nothing, it simply means chemical that bind to a receptor. Okay, so over here the ligand is ACH. Okay, so suppose this is ligand and this is a receptor. Okay, so say if ACH is binding to this receptor, then we call ACH as a ligand. Okay, so whenever ligand get attached to nicotinic receptor, then the door will open. So normally when the nicotinic receptor is not attached to this ligand ACH, the door is closed. But when the ligand ACH bind to the nicotinic receptor, the door will get open. So when the door will get open, then the more the sodium will enter the cell, when more calcium will enter the cell, and more potassium will leave the cell. And due to this, more positive charge is entering and less positive charge is coming out of the cell. So this will change the electrical charge, and in that case then the cell will start a rapid response. Okay, so simply when the ligand ACH get bind to nicotinic receptor, the door will get open and lots of sodium and potassium will enter the cell, and lot of sodium and calcium will enter the cell, and potassium will leave the cells, and that will change the electrical charge and cell will start responding. Now we'll talk about the types of nicotinic receptors. Okay, so normally there are two type of nicotinic receptors, one is NN and one is NM. So let's first talk about NN. Okay, so the full form of NN is nicotinic neuronal. Okay, and this receptor is mainly found in autonomic ganglia and adrenal medulla. So let's see the story lecture. Okay, so as we all know that autonomic ganglia is where the preganglionic neuron and postganglionic neuron meet. Okay, and over here also there is NN receptor. Okay, nicotinic receptors, and the second one is in the adrenal gland, over in the adrenal medulla. So when ACS get attached to this NN receptor, then it stimulates the postganglionic neuron. Okay, and in case of adrenal medulla, when NN receptor get attached to ACS, it will release epinephrine and norepinephrine. Okay, so it's written here same thing, that it is found in autonomic ganglia and adrenal medulla, and when ACS bind, that it stimulates the post ganglionic neuron, and when ACS bind to NN junction of adrenal medulla, it will release epinephrine and norepinephrine. Now let's talk about NM receptor. Okay, it's also a type of nicotinic receptor. Okay, so the full form of NM is nicotinic muscle receptor. Okay, and it is mainly present at neuromuscular junctions. Okay, so when ACS bind to this NM receptor, the skeletal muscles start contracting. Okay, so from a study picture we can see that in somatic nervous system, voluntary motor nerve starts from the spinal cord, and it will release reach NM junctions, neuromuscular junctions, and it releases ACH over here. Okay, and this ACH will bind to NM receptor, and it will start contraction of muscles. Okay, so suppose this is a muscle. Okay, then when ACH is attached to the NM junction over here, then it will start contracting. Okay, so this is how this NM junction works. Okay, so there is one important clinical correlations of NM junctions. Okay, we all know about the disease called myasthenia gravis. Okay, so in myasthenia gravis, our body make antibodies against these NM receptors. Okay, suppose these are the NM receptors. Okay, when antibodies will start binding these NM receptors, okay, then there will be very less place for the ACH. Okay, because when ACH will come to bind over here, here is antibody already bind to these sites. Okay, so that is there, that in myasthenia gravis antibodies against these NM receptors. So ACH released normally, our body is producing the ACH in normal amount, but very few NM receptors are for ACH. Okay, because all the receptors are getting occupied by these antibodies. So the what happened, so the normal function of NM nicotinic receptor to contract the muscles. So in myasthenia gravis, the muscle will not contract properly. Okay, so this is the main problem what happened in myasthenia gravis. Okay, so what happened, so the patient will develop dropping eyelid, double vision, difficulty swallowing, and muscles weakness. Okay, so in those conditions we will give acetylcholine esterase inhibitor. Why? Because when we give acetylcholine esterase to those patients, then the ACH will not get destroyed. More and more ACH will accumulate over here, and it will just push this antibodies and start occupying this space. Okay, so whenever the questions will ask that what happened in myasthenia gravis, so in myasthenia gravis the body will start forming antibodies against these NM receptors. Okay, so this is about NN and NM receptor. Now let's talk about muscarinic receptors. Okay, so these muscarinic receptors are G protein coupled receptor. Okay, as these nicotinic receptors are ligand gated, and ligand is nothing, is simply ACH. In the same way, this is a G protein coupled receptor, and this G protein is nothing, is simply a protein. Okay, so when ACH is bind to muscarinic receptor, okay, suppose this is a muscarinic receptor. Okay, when ACH come and bind to these muscarinic receptors, then this will activate the G protein. Okay, and this G protein will activate a second messenger in the cell. Okay, so let's understand this. Like, okay, suppose this is a muscarinic receptor. Okay, this is a muscarinic receptor. Okay, when ACH will come and bind to these receptors, okay, then the protein called G protein, okay, G protein will get activated. Okay, and this G protein will, what will do, inside the cell there are secondary messengers. Okay, there are secondary messengers. These secondary messengers will get activated, and when these secondary messengers will get activated, then the cell will start responding to ACH. So when we will define what is secondary messengers, then this is nothing. These are small molecules inside the cell like IP3, DAZ, and CAMP. Okay, so this muscarinic receptor is G protein coupled receptors. When ACH bind to the muscarinic receptor, it will activate G protein, and when G protein will activate, then the secondary messengers will come from the cells like IP3, DAZ, and CAMP. So now let's summarize our today topics. Okay, so we all know that there are two types of ACH receptors. One is nicotinic and one is muscarinic. Okay, while talking about nicotinic receptors, so these are ligand gated and fast acting. Okay, why fast acting? Because it get response from this entering of sodium and entering of calcium, and there is nothing called secondary messengers over here. Okay, and while talking about NN receptors, so NN receptors are found in autonomic ganglia and adrenal medulla. And while talking about NM receptor, so these are found in NMJ junction, that is neuromuscular junctions of skeletal muscles, and these muscarinic receptors are G protein coupled receptor, and these are slow in comparison to nicotinic receptors. Okay, and but they are long lasting. Okay, and they uses secondary messengers to act. So this is all about acetylcholine receptor, that is nicotinic and muscarinic receptor, how they works and how they are working in our body. Okay, and yesterday we covered autonomic receptors from in our last shot. So we've covered autonomic and acetylcholine receptors. Now tomorrow we'll talk about different M1 muscarinic receptors, M1, M2, M3, and in the next few shots we'll talk about alpha 1 receptor, alpha 2 receptor, beta 1, beta 2, and beta 3, and we'll move forward in our pharmacology series. Okay, so thank you for watching. If you like this video, please share with your fellow medicos, and please subscribe my YouTube channel and follow me on Instagram and Facebook. Thank you.